Hi friends, welcome back to the Nurse channel. So today we have come up with the second part of our JIPMER series. But unfortunately, you all came to know that our JIPMER exam is postponed because of some administrative reasons. I think you have seen the circular. There is no change in the other exams, but nursing officer exams they have postponed, and the date also is not known. Okay, so our series will continue like this because definitely this series will definitely will help you not only for the JIPMER exams but also for other upcoming nursing officer exams like ESIC, then Punjab Government Medical College exams and Kerala PSC for the assistant professor. Okay, so definitely this series definitely will help you. So continue watching. So before starting our today's session, I request everyone who are watching this video who have not yet subscribed our channel, kindly subscribe and support us. And whenever we are getting any updates regarding the JIPMER exam, definitely we will share with you. So today again we are going to discuss another 20 question and answers which includes the current affairs and GK with detailed explanation. So it will not be it will be a good session for you, and so kindly watch till the end of the video and kindly share your feedback. So straight away we will move on to the today's series, that is a part 2 of our JIPMER series with 20 question and answers with rationale. So we will start our session. JIPMER series part 2 with 20 question and answers. Okay. So here comes the first question for you. So the first question is from the blood. Okay. It's very important question, and the question is therapeutic level of INR for patients on Warfarin should be. Okay. So the question is the patient is on Warfarin therapy. So what should be the therapeutic level of INR? Okay. So your options are option number A below 1.1, option number B 2.0 to 3.0, option number C 3 to 4.5, and option number D 1 to 2. So what is the answer? So the patient is receiving Warfarin, and how much should be their therapeutic INR value? Okay. So what is the answer? So the answer is it should be the INR level should be 2 to 3. Okay. So we will see. So see, you know that in healthy people the normal INR is 1.1 or below. Okay. So that is considered to be normal. Okay. So normal people the INR should be 1.1 or below. Okay. So this is the answer for another question. So what is a normal INR for a healthy normal people? It should be less than 1.1. Okay. And an INR range of 2.0 to 3.0 is generally an effective therapeutic range for people taking Warfarin. Okay. So this is the answer for our question. Okay. So that's all about the first question. So we will move on to our second question. So the second question is, which is the integrative center for emotions, emotional behavior and motivation in the brain? Okay, so this is the central nervous system anatomy. Which is the integrative center for emotions, emotional behavior and motivation in brain? Okay, so your options are the option number A frontal lobe, option number B hypothalamus, option number C amygdala, and option number D medulla. Okay, so which among these areas are considered to be the center for emotions, emotional behavior and motivation in brain? So what is the answer? So definitely the answer is option number C, that is amygdala. Okay, so you know that where is amygdala? You can see the picture now. So the amygdala are a pair of small almond shaped. Okay, so the shape of amygdala is almond shape, and these are the regions deep in the brain, and it helps regulate emotion and encode the memories. Okay, so the amygdala is located in the medial temporal lobe, just anterior to the hippocampus. Okay, so just anterior to the hippocampus we can see the amygdala, which is located in the medial temporal lobe. Okay, so so this explanation will give you answer for so many questions. So how many amygdalas are there? There are 2 amygdalas, that is a pair of amygdala will be there. And what is the shape? That is an almond shape. And where it is situated? It is located in the medial temporal lobe, and it is positioned just anterior to the hippocampus. And what is the function? To regulate the emotion and encode the memories. Okay, so that's all regarding the amygdala. Okay, so moving on to our third question. The question is, bands of tissue that help connect bones, joints and organs and hold them in place is named as. Okay, so the question, it is from the ortho. Bands of tissue that help connect bones, joints and organs hold them in place is named as. So the options are option number A, tendon, option number B, ligament, option number C, both tendon and ligament, and option number D, cartilage. So what is the answer for the question? So at the end of this question, I have two more questions for you that you have to answer and answer in the comment box. Okay. So what is the answer for this question? So the answer for this question is ligament. Okay. So don't be confused between tendon and ligament. So we will see what is a tendon and what is a ligament and what is a cartilage. Okay. So you know that ligaments are the tough fibrous band of connective tissue that serves to support the internal organs and hold bones together in proper articulation at the joints. Okay, so what are ligaments? Ligaments are made up of tough fibrous band of connective tissue. Okay, so connective tissue, it is made up of tough fibrous band of connective tissue and it serves to support the internal organs. Okay, so we know that the internal organs are placed in the position with the help of some ligaments. Okay, and it holds the bones together in place in proper articulation at the joints. Okay, so that is ligament. So what is a tendon? So you know that a tendon is a fibrous connective tissue. This also is a fibrous connective tissue that attaches muscle to the bone. Okay, so this is bone to bone. Ligaments are bone to bone connection and tendon is a muscle to bone connection. Okay, so here comes a question for you. Which is the largest tendon in our body? So which is the largest tendon in our body, which is the largest and strongest ligament in our body? Okay, so these two answers you have to comment. You can comment in our comment box and the answer for these questions will be discussed in the next series. Okay, so the question for you is which is the largest and the toughest ligament in our body and which is the largest tendon in our body. Okay, so we will discuss the answer in our next series. Okay, so the other option was cartilage. Okay, so what is a cartilage? Cartilage is a flexible connective tissue that keeps joint motion filled by coating the surfaces of the bones in our joint and by cushioning the bones against the impact. Okay, so whenever there is an impact like RTA, road traffic accidents or any fall or something like that, there the bones will be protected by a cushioning effect and that effect will be given by a flexible connective tissue known as the cartilage, which keeps the joint motion fluid by coating the surfaces of the bone in our joints. Okay, so it will keep the bones in our joints. Okay, so that's about the cartilage. So from this question we will be getting information regarding the ligament, the tendon and the cartilage. Okay, and two more questions I asked, so that answer I am expecting in the comment boxes. Okay, so moving on to our next fourth question in this series. So it is a question from the GK. Okay, it's a general knowledge question. Which is the hottest planet in the solar system? It's a simple direct question. Which is the hottest planet in the solar system? But it's a little confusing also. Okay, so we will see the options. The options are option number A, Mercury, option number B, Venus, option number C, Mars, and option number D, Jupiter. So among these, which is the hottest? Not among these, which is the hottest planet in the solar system? What is the answer? So it's not Mercury, it's Venus. So definitely you will have a doubt like Mercury is near to the sun. No, so Mercury will be the hottest planet, but the answer is Venus. Okay, why means even though Mercury is closer to the sun, the Venus is the hottest planet in our solar system because its thick atmosphere is full of greenhouse gas known as the carbon dioxide and it has clouds of sulfuric acid. So because of that, Venus is considered to be the hottest planet than the Mercury, even though Mercury is nearer to the sun. Okay, so that is the answer for the simple GK question. So we will move on to our next question, that is question number 5. It is from the basic cells. Okay, regarding the cell, which organelle is known as the suicidal bag of cells? Okay, so it's a direct question. Which organelle is known as the suicidal bag of cells? Okay, so the options for you are, the first option is option number A, mitochondria, option number B, ribosomes, option number C, lysosomes, and the final option, nucleus. So what is the answer? Which is considered to be as a suicidal bag of cells? So what is the answer? So definitely the answer is option number C, that is lysosomes. Okay, so we know that the function of each cells. Okay, that functions we will see in brief in our explanation. So we know that what is the answer for our question was lysosomes. So these lysosomes are organelles with an acidic lumen containing hydrolases. Okay, and whose role is to break down macromolecules into their subunits. Okay, so it is considered to be as the what to say, as the suicidal bag of cells. Okay, so lysosomes, it contains a substance, contains as acidic lumen known as the hydrolases. What is their role? It will break down the macromolecules into their subunits. Okay, so now we will see what is a ribosome. So ribosomes are peculiar for their function of protein synthesis. Okay, so these are center for the protein synthesis. Ribosomes are for protein synthesis. Then you know that mitochondria, the mitochondria is the powerhouse of the cell, that is the energy production. Okay, and final option was the nucleus. So you know that nucleus is the center part of the cell, and it controls and regulates the activities of the cell. Okay, so from this question we are getting answer for nearly 4 questions. First of all, the lysosomes, which is considered to be as a suicidal bag of the cells, and it will break down the macromolecules into micromolecules, and it contains hydrolases. Okay, and with an acidic lumen. So ribosomes, they are concerned with the protein synthesis. Mitochondria, it is the powerhouse of the cell, and the most important nucleus, it controls and regulates all the activities of the cell. Okay, so that's all regarding the question. I think it is clear for you. So moving on to the next very important question. So don't be confused. So the question you should read very carefully. Lifespan of RBC in newborns are dash days. That means lifespan of RBC in newborns are dash days. Not in adult. It clearly asked specifically for newborns. So the options for you are option number A, 110 to 120 days. Option number B, 100 to 130 days. Option number C, 50 to 60 days. And option number D, 60 to 90 days. So what is the answer? Lifespan of RBC in newborn. So what is the answer? So in adult, you know. So in newborns, the lifespan of RBC is 60 to 90 days. Okay. So in contrast to the adult, RBC lifespan of 120 days, the lifespan of the neonatal erythrocyte is only 60 to 90 days, with preterm infants having an even shorter lifespan of 35 to 50 days. So from this question also, now we are getting answer for 3 questions. So the lifespan of RBC in normal adult person it will be 120 days, and for newborn it is lesser than that is 60 to 90 days, and for preterm infants it will be 35 to 50 days. Okay, so this also is a very important question. So now we will move on to the next question in our JIPMER series, that is the 7th question. Is a GK, and the question is Indus River originates in. So where the Indus River is originated. Okay, Indus River originates in, and the options are Kinnaur, Ladakh, Nepal and Tibet. Okay, so among these options, from where the Indus River originates. So what is the answer? So the answer is option number D, Tibet. Okay, Indus River is originating from the Tibet. So so we'll move on to our next question in our JIPMER series, that is the 8th question. So here comes the 8th question. The question is, the most common site of myocardial infarction is. The question is very straight and clear. The most common site of myocardial infarction is. So your options are option number A, posterior wall, option number B, anterior wall, option number C, inferior wall, and the final option number D, lateral wall. So the most common site of myocardial infarction. So what is the answer? So the answer is anterior wall. Okay, anterior wall is the most common site of myocardial infarction. So just remember the anatomy of the heart and the coronary circulation. So we know that the left anterior descending coronary arteries supplies the anterior tissues of the myocardium. Okay, so the anterior wall of the myocardial infarction occurs when anterior myocardial tissue, usually supplied by the left anterior descending coronary artery, suffers injury due to lack of blood supply. Okay, so left anterior descending coronary artery supplies the anterior myocardial tissues, and whenever there is an insult to this artery, results in the anterior myocardial MI, which is the most common site of myocardial infarction. Okay, so moving on to the 9th question in our JIPMER series. The 9th question is, which among the following is an adverse effect of long-term phenytoin therapy? Okay, so the question is, which among the following is an adverse effect of long-term phenytoin therapy? So you know that phenytoin, or clinically we call it as eptoin, is a drug which is used as an anticonvulsant. Okay, so the question is, which is the long-term adverse effect of phenytoin therapy? And your options are, the first option is gingival hyperplasia, The second option is alopecia. The third option is confusion, and the final option is glossitis. So which is the adverse effect of long-term phenytoin therapy? So what is the answer? So the answer, you know that option number one, that is gingival hyperplasia. Okay, gingival hyperplasia. So we will see which other medicines also can result in the gingival hyperplasia, like side effects. Okay, so the medically induced gingival hyperplasia can be seen in about 40 to 50% of the patients taking phenytoin, and along with that the side effect can be seen in other drugs like cyclosporin. It is an immunosuppressant, and calcium channel blockers. It is an antihypertensive. Okay, so these drugs can cause side effects like gingival hyperplasia. Okay, phenytoin, cyclosporin, and calcium channel blockers. Okay, so the answer is clear for you. We will move on to the next question in our JIPMER series. Then question number 10. The question is, Reed-Sternberg cells are seen in which disease state? Okay, question is very straight and clear. The Reed-Sternberg cells are seen in which disease state? And the options are, the first option is acute lymphocytic leukemia, or ALL. Then the next option, option number B, Hodgkin's lymphoma. Then the third option, melanoma, and the final option, non-Hodgkin's lymphoma. Okay, so the Reed-Sternberg cells can be seen in which among these disease states? So what is the answer? It's a direct question. So the answer is option number B, that is Hodgkin's lymphoma. Okay, so you know that the Reed-Sternberg cells, these are the large abnormal lymphocytes. Okay, so these are lymphocytes. You know that lymphocyte is a type of white blood cells, and it contain more than one nucleus. Okay, so that is a peculiarity of this particular lymphocyte, which is termed as the Reed-Sternberg cells. The peculiarity is that it has more than one nucleus. Okay, and it is seen in the which disease state? That is Hodgkin's lymphoma. Okay, so that question also was very clear. So moving on to the next question, that is 11th question. It's regarding the position. So how to position a child in hypercyanotic spell? Okay, so a child is in the hypercyanotic spell, then how you will position the child? Okay, so the question, I think the question is clear for you. So the options are, the first option is high Fowler's position. The second option is knee chest position. The third option is lateral position, and the final option is prone position. So in which position you will keep the child in hypercyanotic spell? So what is the answer? Answer is very clear. That is, answer is option number B, that is knee chest position. Okay, so we know that what is a hypercyanotic spell. Okay, so the hypercyanotic spell, also called as a cyanotic spell, or hypoxic spell, or TET spell, or hypercyanotic spell. Okay, it is occurs in young children or young infants with tetralogy of Fallot. Okay, so I am not going in detail about the tetralogy of Fallot. So this hypercyanotic spell, or the cyanotic spell, or the TET spell can be seen in young infants with tetralogy of Fallot. And if we are positioning the patient in the knee chest position, and this position traps the systemic venous blood in the legs. Okay, so this position will trap the systemic venous blood in the legs, and thereby temporarily decreasing the systemic venous return. Okay, so the systemic venous return will be reduced and helps to calm the baby. Okay, so this is the principle with knee chest position. So it may also increase the systemic vascular resistance by reducing the arterial blood flow to the lower extremities. Okay, so the knee chest position will trap the systemic blood in the venous blood in the leg, and thereby temporarily decreasing the systemic venous return, and at the same time it increases the systemic vascular resistance by reducing the arterial blood flow to the lower extremities. Okay, so this is how knee chest position will calm down the baby. Okay, so moving on to our next question, that's a 12th question. It's a GK question. Which is the capital city of Ukraine? So which is the capital city of Ukraine? So it's a current affairs, in the news and all you are hearing about this city very frequently. So your options are, the option number A is Kiev, option number B Kharkiv, option number C Odessa, and option number D Sevastopol. So which is the capital city of Ukraine? So the capital city is, answer is Kiev. Kiev is the capital city of Ukraine. Okay, so moving on to our next question. It is related to a vitamin, and the question is, the 13th question, Wernicke's encephalopathy occurs due to the deficiency of which vitamin? So the question is, Wernicke's encephalopathy occurs due to the deficiency of which vitamin? So the options are vitamin B12, option number B vitamin B6, option number C vitamin B1, and the final option vitamin B3. So what is the answer? Wernicke's encephalopathy. So the answer is vitamin B1. So you know that what is Wernicke's encephalopathy. So Wernicke's encephalopathy is an acute neurological condition which is characterized by a clinical triad of ophthalmoparesis with nystagmus, ataxia and confusion. Okay, so it is a neurological dysfunction, and it is characterized by a clinical triad of ophthalmoparesis with nystagmus, then ataxia and finally confusion. Okay, and this is a life-threatening illness which is caused by the thiamine or B1 deficiency. Okay, so the answer for our question is vitamin B1. Okay, so this is Wernicke's encephalopathy, and every time we have heard about Wernicke's encephalopathy along with the Korsakoff psychosis, and these conditions can be seen in patients who are addicted to alcohol for a long period of time. Okay, a long-term alcohol addiction can lead to the complications like Wernicke's encephalopathy and Korsakoff psychosis. Okay, so these are the Korsakoff psychosis is a stage of Wernicke encephalopathy. Okay, so we will see the other options. We in the option there is a option called vitamin B12, and we know that the vitamin B12 deficiency or the cobalamin deficiency can result in anemia or nervous system injury, and the next option was niacin, otherwise vitamin B3. It can result in the deficiency can result in pellagra, and the final option was the riboflavin or vitamin B2, and this deficiency can result in araboflavinosis. Okay, araboflavinosis. Okay, so that's all regarding the 13th question. Now we will move on to the next question. It is from the genetics. So the question is, simian crease can be seen in which among the following diseases? Okay, simian crease can be seen in which among the following diseases? Okay, so the options are, the first option is Down syndrome, the second option is Ars-Cook syndrome, the third option is fetal alcohol syndrome, and the final option is all the above. So which among the following diseases, in which among the following diseases we can see the simian creases? So what is the answer? So the answer is all the above. That means in Down syndrome, in Ars-Cook syndrome, and in fetal alcohol syndrome we can see simian creases. Not alone in Down syndrome. You know that it is slightly confusing. So we will see the syndrome. What is this? These syndromes are. The first one is the Ars-Cook syndrome. So what is the Ars-Cook syndrome? So it is a genetic disorder that is linked to the X chromosomes. Okay. So in this disease also we can see simian creases, and in the Down syndrome, obviously that you know, it is a genetic chromosome 21 disorder which causing the developmental and intellectual delays, and the other option was the fetal alcohol syndrome. So these are a group of conditions that can occur in a person whose mother drank alcohol during the pregnancy. Okay, so in these three disease states we can see simian creases. Okay, not only in the Down syndrome. Okay, in Down syndrome, Ars-Cook syndrome, and fetal alcohol syndrome. Okay, so I think it is clear for you. Now we will move on to our 15th question. It is related to GK. Who is known as the Indian Hippocrates? Who is known as Indian Hippocrate? So your options are option A Charaga, option B Hippocrates, option C Kashyapa, and option D Sushruta. So which among these personalities was known as the Indian Hippocrates? So what is the answer? So the answer is option number D, Sushruta. Okay, so Sushruta, he was a physician in the ancient India, and today he is known as the father of Indian medicine and father of plastic surgery. Okay, he was also known as father of plastic surgery for his inventions and developments in the surgical procedures. Okay, so Sushruta is known as the father of Indian medicine or Indian Hippocrate or father of plastic surgery. Okay, so moving on to our next question, that is a question number 16. MDMP, that is midday meal program, is also known as, okay, midday meal program is also known as dash. So the question is very clear. MDMP is also known as dash. So the options are school meal program. The first option is school meal program. The second option is school lunch program. The third option is school dinner program, and the final option is school nutritional program. So what is the answer? MDMP or the midday meal program is otherwise known as, so the answer is school lunch program. Okay, school lunch program. So we know that MDMP was launched on 15th of August 1995. Okay, so it was launched on 15th August 1995 and it was revised in 2004. Okay, so the purpose of the midday meal program is to provide 300 calories and 8 to 12 grams of protein per day per children. Okay, so this is also very important. So through midday meal program they have aimed at 300 calories and 8 to 12 grams of protein should be provided in a day for every child. Okay, so that is the MDMP program which was launched on 15th August 1995 and was revised on 2004. Okay, so moving on to our 17th question. It's a simple GK question. The question is, which is the largest country in Asia? So which is the largest country in Asia? So the options are option number A, South Korea, option number B, India, option number C, China, and option number D, Japan. So which among these is the largest country in Asia? So obviously you know the answer, that is China is the largest country in Asia. Okay, so we'll move on to the 18th question. Yeah, it's a very important question and a confusing question. The question is, apical area in an infant is in dash. So the question is asked about the position of the apical area. So you know that what is the peculiarity of apical area. So apical area in infant is in dash. Where is apical area in children? So the options are third ischias or the intercostal space, fourth ischias, fifth ischias, or in the second intercostal space. So which is the answer? The options are third intercostal space, option number B, fourth intercostal space, option number C, fifth intercostal space, and option number D is the second intercostal space. And you should be very careful about this question. The question is asked about the apical area in infants. Okay, so what is the answer? So the answer is fourth intercostal space, and it is not the fifth intercostal space as in adult. Okay, so the suitable site to check the pulse in the newborn is apical area, that you know very well. An infant's pulse is stronger in the apical area, which is considered to be in the fourth intercostal space, not fifth like adult. Okay, so preferably it is the most common site of checking pulse in the newborn. Okay, so many questions we are getting from this question. So which is the common site of checking pulse in the newborn? So where is the apical area? So where is the apical area in adult and in the infant? Okay, so the answer for all these questions we have got from one question. Okay, so the answer for our question is fourth intercostal space. Okay, in infant it is in the fourth intercostal space, but not in the fifth intercostal space. It is for the adult. Okay, so moving on to our second last question in our JIPMER series, that is regarding the fluid and electrolyte imbalances. The question is, fluid balance is best monitored by. Okay, so how we can monitor fluid balance? Okay, the options are, first option is daily weight, the second option is skin turgor, third option is capillary refill, and the final option is intake and output. Okay, so in which way we can monitor the fluid balance in the best way? So what is the answer? So all these things are parameters of checking the hydration status of the patient. So our question is, which is the best method for monitoring the fluid balance? So what is the answer? So the answer is daily weight. Okay, so we know that one of the most sensitive indicators of the patient volume status is changes in their body weight. Okay, so patient weight changes approximate a gold standard to determine the fluid status. Okay, so body weight is the most and the best suitable method for determining or monitoring the fluid status of a patient. Okay, so moving on to our last question in this series, and the question is, which act makes it illegal to determine the sex of the unborn child? So which act makes it illegal to determine the sex of a unborn child? That is the question, and the options are option number A, Children Act 1908, option number B, Guardianship and Wards Act 1890, then PCPNDT Act 2003, and the final option, the Children and Social Work Act 2017. So among these options, which is the answer, that which act makes it illegal to determine the sex of the fetus? So what is the answer? So the answer is option number C, that is PCPNDT Act. Okay, so the Preconception and Prenatal Diagnostic Techniques Act, or the Prohibition of Sex Selection Act 2003, commonly called as the PCPNDT Act, makes it illegal to determine the sex of the unborn child or even the usage of the sex selection technologies. Okay, so PCPNDT Act, otherwise known as the Preconception and the Prenatal Diagnostic Technique Prohibition of Sex Selection Act, which was came into effect in 2003. Okay, so with that we are coming to the end of this session. So I think these 20 questions which I have kept in the series will be very useful for you in your preparation for your not only for the JIPMER exam, for the other competitive nursing officer exams. So once again, thank you for watching the video till the end. So so we will be coming with another set of questions very shortly. So till that time, stay tuned, study well, and continue watching. Okay, thank you.